Hi everyone, my name is Abhinav Suri. I'm a second year medical student here at UCLA, at least at the time of this recording. And today I want to give you a presentation on some of the important aspects of the physical exam and just how important I found it to be whenever going into my clinical rotations, which you will be doing in about a year. So first of all, props to anyone who can pick out what movie this is from. But regardless, I think that one of the things that I remember thinking early on in my med school career as an MS1 was what was the real importance of the physical exam. There are CT scans now, the donut of truths. There's a lot of talk about POCUS being the stethoscope of the 21st century. But ultimately, what you have to realize is that when you see a patient for the first time, you're often not going to have an ultrasound machine available next to you, and you certainly won't be in the CT scanner room, or at least hopefully you aren't, because that means that the patient is doing really badly. So in that 10 to 15 minutes that you initially see a patient, you have to rely on your stethoscope, your brain, and maybe a reflex hammer to order to figure out what is actually going on with the patient and what diagnostic things that you want to do next. And being able to figure out a solid plan for what you'd like to do just based off the physical exam is something that is you're going to develop over your course as a clinical rotation student. But the foundation of that is having a really solid understanding of the physical exam and what each of the individual physical exam signs mean. And to really drive home a point about how important the physical exam is, at least in the first patient encounter, I want to tell you all a story about a patient encounter that I had with an individual when I was on the emergency medicine rotation here at Reagan. So basic story was that this was a 70-year-old woman, no notable past medical history, just came in today saying that she felt tired over the past few days. Her history was otherwise completely negative. She didn't have any recent infections. She didn't have any recent syncope or seizures, or she didn't feel short of breath, just overwhelming sense of tiredness. So ROS wise, I asked her pretty much every single system, still pan negative. So I decided to just do a regular physical exam, which is cardiovascular, lung, and abdomen. Her cardiovascular exam was normal, but when I went to her lung exam, I noticed a slight abnormality. When I was listening over her right lung field, I was able to hear her breath sounds perfectly fine, both in the upper and lower aspects of the lungs. However, whenever I went to her left lung field, I found that I could hear her upper lung field fine, but her lower left lung field, actually, I didn't hear anything. I checked my stethoscope, it was working. So I decided to then do a physical exam maneuver that I learned in FOP, which was percussion. So percussion, I percussed, which is basically tapping on the right lung. I heard that it was resonant. And then on the left lung, the upper field was resonant, but the lower field was dull. And in my mind, I knew that, oh, dullness could potentially mean that this person has a pleural effusion or maybe pneumonia. So I exited the room. I went to my attending. I said, hey, I'm not sure exactly what's going on with this person, but they had dullness to percussion on their left lower lung field. I think that we should probably get a chest x-ray. The attending agreed, and this is roughly what her chest x-ray looked like. Yeah, that's a pleural effusion. And if I hadn't done that physical exam sign, maybe it could have been discovered because, just in general, people who come to the ED kind of just get a chest x-ray to begin with. But at least that physical exam sign led me to the point that I had a pretty high degree of confidence that I knew what was going on with her. And I was really proud of that moment because at that point I knew that all that physical exam learning and practicing on normal patients and SPs really trained my ear to figure out what is baseline and what can be considered abnormal. And this person was definitely abnormal. So maybe that convinces some of you to spend a little bit more time practicing your physical exams. I'm not sure, but I found that this story was really helpful in solidifying my faith in the physical exam. And just to emphasize a little bit further, if you want to spend 2 minutes looking at this video, this is a clip from a documentary called Making Rounds. It's about two attendings who basically are old school and they emphasize the importance of a physical exam above all other diagnostic tests. I would highly recommend that you take some time and watch it. It's just really motivational for beginning medical students in general. But here's a really helpful clip telling you the importance of the physical exam.
So this is unusual, no? To say the least. How are you feeling?
I'm feeling better than I felt last night.
No pain anymore?
Not right now, no.
And you never had any trouble walking down the street with chest pain? This happened out of the blue, this chest pain?
Correct.
Was this chest pain similar to the one you had
A week
the
ago?
first time? Yeah.
Yeah. It comes on suddenly and just the pressure just keeps getting more and more and more intense. And then the chest pain is more like a little bit of a rising burning sensation.
You said that your discomfort arose
It
in the
starts,
left.
it starts here.
You didn't see anything. You just felt it there.
You don't, nobody's seen anything, you just feel it.
Are you double jointed?
No,
Do this. Wrap your fingers around.
do that.
This is a very important finding at the bedside. You see what she does. If I go like this, but there's a space there. So that is very much morphinoid, or it can be, as you know. So we ought to do some genetic testing, because that's a real finding. Just looking at the hand and showing that there are 100 diseases that you can see by looking at the hands. So you can go to the bedside, and there are many signs at the bedside which give you clues. They're called bedside clues to the diseases of the heart, and they can change your thinking. Because then you say, oh, this patient has this disease, therefore we can't do this, we can't do that, or we should do more, and so on. So we always look at the hands, and you do it just by holding the patient's hands and looking. In other words, you can look. It takes you a second, while you're doing everything else, so it doesn't take any time. Yeah, so there are exciting things you can learn, and everybody's astonished. They say, oh my God, we missed it, and something like that.
So I just want to leave you all on this note. You all have an excellent opportunity ahead of you right now. In FOP, you have unparalleled access to standardized patients who are so gracious and willing to spend so much time with you to help you learn. I would suggest that you take the complete advantage of every opportunity you get to practice with standardized patients. Yeah, they won't have every single abnormal finding on physical exam, but being able to establish exactly what normal sounds like and feels like on your physical exam maneuvers is going to be critical whenever you head into the wards in not that long from now. So I would highly recommend that you take the time to practice your physical exam maneuvers whenever you have the chance. It will be awkward at first, but trust me, you'll eventually get better. And as I say, practice makes perfect. So thank you all for listening to me for this presentation. If you have any other questions, feel free to email me. Thanks.